Hello.
Two, two.
my formal inaugural address, but honestly, let me say, I would like to add a few more sentences. That when I heard the previous speakers, I'm really stupefied. And for me, this is the first opportunity to attend a conference on this subject. Therefore, all the more reason for me to feel exasperated. It appears to be such a big threat. The only thing that I can tell you, the organizers and those who have spoken before me and the delegates, is that this is not a subject, as far as I am concerned, which can be dealt with in just one conference. I would request you to, you are going to deliberate about this subject, the threat, the menace, and I would like you to come with concrete proposals so that we can have a system in place where regular monitoring or regular efforts can be made on a regular basis to create more awareness, to create a campaign against the substance misuse, and I assure you, I will be more than happy to be fully involved with any such campaign. We cannot ignore, we simply cannot ignore the facts which have been brought into light by the previous speakers, and this information about this, the magnitude of the menace affecting our schools has really shaken me. And I must admit, I was not aware of this. So I would like you to come with concrete proposals how we can have a system in place where we can, on a regular basis, we can conduct this campaign, we can include people in this campaign, and I shall be, as I said earlier, I feel I shall be really performing my duty as head of the state if we are able to save our children. If we are able to save our children, everybody, but more so the children, from this threat. I am thankful to all of you for giving me a patient hearing, and I wish you all the best in your deliberations, and I will be looking forward to hear from you what concrete proposals you have. Thank you very much. Jai Hind, Jai Bharat, Loka Samasta Sukhino Bhavantu. Thank you very much.
What can India do? What can Asia do? Then I'm thinking of a young girl. She has been sitting outside the parliament in Sweden for 1 year. And the last days she has been in New York. She refused to say hello to Trump because he denies the climate change. But she has given strength and hope to young people all over the world. We need, you and me, we need to find those people from our side who could stand up for a better life in the future without drugs. Thank you.
I know you are hungry and maybe lunch is waiting, but yes, we are talking on some serious subject. So maybe we'll start with a new word for those who don't know. So can we together say Venda? So you have just told me you don't want lunch. Have you? Okay, because Venda in our language means no. And that is what the project is all about, where we encourage children to say no, not just to drugs, but there is a culture around here. For example, let's say there is a party happening at home and the parents or the father is drinking, and tendency is to ask the child to get the glass or the ice or the water. So we tell or we encourage our children to start saying no there itself.
Okay, now we're talking about the international standards of prevention of drug use. Basically, we're talking about three things: the drug, the environment, and the person. Now, as far as the drug and the environment is concerned, we talk about various things like the availability and the pricing, and I mean, there are a lot of policy issues involved, a lot of regulatory issues involved. So we are concentrating on the supply reduction, which is really not our job. I mean, I won't say it's not our job, but it's not our priority. And that should be looked after the enforcement. Our emphasis basically is on the person. I mean, I'm sure a lot of you, not a lot of you, but a lot of us take alcohol, but everybody doesn't go and become dependent. Some people become dependent. Why? I mean, that is the question. Why do they become dependent? Because they have some vulnerabilities. Vulnerabilities could be their disadvantage in some way. It could be physical, it could be psychological, it could be emotional, it could be economic. I mean, there's so many things. How they become vulnerable. So we have to make these people stronger. That is what our main focus is on.
Some say alcohol is not pleasurable, some say alcohol is pleasurable, some say it's only for expectancy, some say it's because of the chemical, right? So, but I'm not going to do that now. But I think this is a very interesting discussion that we can continue next 2 days, because it will affect our work, what we do. Because if we are in a kind of wrong perception of the effect of chemical, so then our things were not in the technically correct form.
So well, I know that regarding the NSS, like, how to maintain the enthusiasm. So that was the question. So, the enthusiasm, I tell you, like, the youth have got amazing enthusiasm. So we don't need to keep the enthusiasm high. It is the enthusiasm of the program officers of the college which matters a lot. That is why what we are doing is, because I've been working with NSS, I traveled a lot, I met so many kids, so they are highly energetic. So they want to be the change agents, they want to change the country, they want to contribute in nation building. The only thing is, if we are giving them direction, proper direction and guidance. The role of the program officers who are the unit head in the colleges and the program coordinators in the universities, if they are committed, if they are dedicated, if they are passionate, you can see the change.
my formal inaugural address, but honestly, let me say, I would like to add few more sentences. That when I heard the previous speakers, I am really stupefied. And for me, this is the first opportunity to attend a conference on this subject. Therefore, all the more reason for me to feel exasperated. It appears to be such a big threat. The only thing that I can tell you, the organizers and those who have spoken before me and the delegates, is that this is not a subject, as far as I am concerned, which can be dealt with in just one conference. I would request you you are going to deliberate about this subject, the threat, the menace, and I would like you to come with concrete proposals so that we can have a system in place where regular monitoring or regular efforts can be made on a regular basis to create more awareness, to create a campaign against the substance misuse, and I assure you, I will be more than happy to be fully involved with any such campaign. We cannot ignore, we simply cannot ignore the facts which have been brought into light by the previous speakers, and this information about this, the magnitude of the menace affecting our schools has really shaken me. And I must admit, I was not aware of this. So I would like you to come with concrete proposals how we can have a system in place where we can, on a regular basis, we can conduct this campaign, we can include people in this campaign, and I shall be, as I said earlier, I feel I shall be really performing my duty as head of the state if we are able to save our children. If we are able to save our children, everybody, but more so the children, from this threat. I am thankful to all of you for giving me a patient hearing, and I wish you all the best in your deliberations, and I will be looking forward to hear from you what concrete proposals you have. Thank you very much. Jai Hind, Jai Bharat, Loka Samasta Sukh.
Good afternoon, everyone. Are we ready for the afternoon? I request all those people in the corridor to come inside the hall. Can we all be seated? Yes, we're going to start the sessions. Can we all come inside? Just a reminder again, we haven't received enough registrations We are around 130 delegates. There are only some 34 registrations for the workshops. So please, when you get time, can you go there? I was told the registration forms are on just next to the help desk. So if you could take a bit of your free time to just sign. Okay, we're going to start the afternoon session. I would like to welcome Mr. Billy Batware, Drug and Crime Prevention Consultants, UNODC. Billy, welcome you to this stage. Billy is a consultant at UNODC responsible for the civil society team's work related to the Commission on Crime Prevention and Criminal Justice, the Commission of Narcotic Drugs, the United Nations Convention Against Transnational Organized Crime. Billy is the founder of the United for Education and Sustainable Futures, whose flagship project is Youth Education Ambassadors. He is also the co-founder of the Regional Academy on the United Nations, founder of International Security and Conflict Analysis Network, a visiting lecturer of international conflicts and development, and a certified trainer in international security. We have with us Billy.
Thank you so much for, Great. Thank you so much for your kind introduction. I'm very, very pleased to be here on behalf of the United Nations Office on Drugs and Crime to be with so many participants, civil society participants, but also on the first day, government representatives. It's an honor for me to have been invited by Fourth Wave Foundation and WFAD to this particular event. And I'm looking forward to what I can share with you. I think it's actually very, very difficult to know where to start, to be quite honest, after listening to so many inspiring presentations for the last 2 days. It's almost impossible, and it's going to be a very tough task for me to keep you inspired for the rest of the afternoon. It's been very, very inspiring for me, and I hope that I can make a contribution to this. So the way that I see how this is going to be, at least for my presentation, my part, is that I have been hearing about what is actually happening on the ground, what you are doing in your communities very, very successfully. And what I am going to try to do is to kind of give you a framework under which, within the international system, under which those activities can actually work better. What kind of systems do we have or policies do we have within the UN system that can actually help you do your work better, or you're actually already contributing to without even knowing. So that's going to be this afternoon. And then later on, after my first presentation, I would like to do it a little bit different, right? So not presenting, but actually put you in groups so that we can do a very interactive activity together. One of my, in my resume, what they said is that I am a certified trainer, so actually I like to do active things, give trainings. I don't really like to give lectures. I rather give trainings, and therefore we will actually do a very practical exercise on how your work can be done better within international context. So that's what I have in mind this afternoon. And just before I start, we just want to play a video about the work of United Nations Office on Drugs and Crime.
I am proud of the support UNODC provides to countries to tackle the interlinked problems of drugs, organized crime, terrorism, and corruption. And I thank you for your important work to safeguard the agreed UN conventions, standards, and norms.
Yeah, as you can see, UNODC does a lot of things. It does pretty much almost everything that is related to what you do in your work, whether it's at the heart of the causes of the interventions that you actually plan or the problems you are addressing, or whether there are effects of some of the problems you are addressing, or they are affecting or at the heart of some of the effects that we are seeing. So issues related to terrorism, for example, I mean, this is another very sensitive issue that we're working on, which is directly, you can find a direct link to drug trafficking or drug issue in general. So this is what I have in mind for you. So I'm going to take you through what we call the 2019 Ministerial Declaration, which is a recent member states agreement on how they can move forward in addressing the world drug problem. And here I will probably ask the help of my good friend and partner, Espion, who is a civil society person who actually has been there from the very beginning in 2008, to just give you a civil society perspective as to how we've gotten there. And then after that, I will give you a little analysis on how and what the declaration is and how you as civil society fit into that. You might, some of you who are familiar with the Angas outcome document, you might already, you can already see where I'm coming from. So my reference is really from the 7 chapters of the Angas outcome document to kind of show you how your work is related to that. And then, as I mentioned, we'll do a very, very interactive session from which I am really hoping, and I'm very glad that the governor yesterday actually emphasized the need of coming up with concrete recommendations, concrete proposals. This is also the aim of this interactive session, so that we can, in groups, try to come up with certain recommendations on how we can do better, how we can plan better interventions in order to address this problem. So, how did we get there? Espion, if you don't mind, I'd like to invite you to come and help me to explain to this. I can explain it myself, but I think this is a civil society conference, and I think it's better to actually hear from a civil society person who's been there from the beginning, who's been our partner for the last several years. Espion, please.
Thank you. No? Hello? Okay, use this. I take this, the blue one. Okay. Well, thank you, Billy. And let's say that I started with the UN and illegal drugs in 90s, in the 94, something like that. And some of you have met me from that moment. I will not say any names. But anyway, 2008, I decided to go to Vienna for, I have only 2 minutes, and I spent 11 years for this. But in 2008, there was 1 week's meeting with, I think it was 800 civil society organizations, discussing the upcoming political declaration and plan of action for the UN when it comes to illegal drugs. And we came to a consensus, what we call the Vienna and the UC 2008 declaration. And that has been the foundation stone when it comes to how civil society should act when it comes to different things. We were not united in every question, but in the end, we had a declaration that was civil society. In 2009, there was a political declaration and a plan of action going for 10 years. They have this in the UN system, and that was taken in New York. At that time, also the countries were starting to be divided, as it is today. It's like the normal thing in the world, more or less. And when it comes to drugs, it's also divided, you know it, between some countries that are going for legalization, some countries that are very doing for no, not representation. They are going on the other side for legalization. They are key. Yeah. And then they decided they wanted to change the venue from Vienna to New York, because in New York there was more political power for some countries to deal with the narcotic drugs issue. That was not the case, because they said that CND should be in Vienna, but during the period, they said we will have a special session in 2016, the UNGAS 2016, between the 10 years span. And we gathered in New York, even there, 800 organizations from civil society. And we had the influence, and as Billy might say, or another speaker said, 11 times in the outcome document, civil society is mentioned as one of the key actors between the governments, between academia, between other business partners and so on. And then from before UNGAS 2016, we created what we call the Civil Society Task Force, because we needed to unite in a special way. And we had quite a good impact. And after 2016, we came into the ministerial segment of 2019 in Vienna. So it has been a long, long process. But during those years, we have moved into the plenary hall in a way that we are now accepted as a key partner when it comes to implementation of what they say in the declarations, with the cooperations with with the governments and other resources. And the civil society has also learned the UN language and the UN behavior, you can say, and that's so important. What we need to do is to convince our leaders, our representatives in New York and in Vienna and Geneva, wherever, that whatever they say about civil society from this place, they should take it back to capital and continue to work with us, and not only saying it in those introduction language. No, Billy.
Thank you so much. Thank you so much, Esbjørn. Yeah, so, I mean, you just heard from someone who actually is one of you, who has been there from the very beginning. I mean, let me just take the blue one. I think the blue works better. My favorite color is blue anyway. Okay, yeah, so yeah, you heard from one of you, and I think one of the key sentence or the key information he just gave us is what happens when those member states agree on these particular policy documents and they go back home, right? The idea is that they implement those policy documents, but how can they do that? And I think the message that I've been hearing here, and I've been in this particular conference and many different other conferences, is that they cannot do it alone, okay? They have to find a comprehensive way to implement these policies, including civil society organizations, right? So that's the key. And that's why you're here, and that's why we're here. And the other key point that I have been listening or heard throughout this conference is that you civil society organizations also see the need to actually have your capacity built, right? You need to have your capacities built in order to do your work better. And this is really pretty much why I'm here. This is what my team does, to try to facilitate the work of civil society organizations in different parts of UNODC mandates, right? So, before I go to this one, or maybe before I go here, Esbjørn told us how we got here. But let me just see by the show of hands, how many people were aware of the 2019 Ministerial Declaration before I started my presentation? Okay, so I see a handful of hands up, like 5, 6. Okay, so I'm probably in the right place, right? Okay, so I'm probably in the right place. And it does not mean that you actually are not contributing to it. You are actually, given what I've been hearing, you are actually doing a lot of work that is contributing to this. So what happened then when we were in Vienna during the ministerial segment? What happened? There we had a record of 2,200 people attending this particular event. It was that important. These were government representatives, civil society organizations, and other stakeholders. We have had, in fact, about 500 civil society representatives in Vienna for those, it was 1.5 weeks or so, right? From different 90 civil society organizations. And there, as Bjorn mentioned, the kind of the flexibility that actually member states created in terms of how they engage civil society organizations after the Angers outcome document, and ours to open the doors pretty much to civil society organizations to be involved. And here you can see, I put on a slide just over here, during these two interactive and multi-stakeholder roundtable sessions, right? It's not usually easy for civil society to get a slot in those particular roundtables because this is an intergovernmental meeting, meaning this government representative coming and discussing what they should do. But as a result of the good work of civil society organizations, member states have been convinced they actually deserve a place at the table. And so they were invited to be part of this roundtable discussions as well, to give presentations about the work that they are doing. And this was facilitated by the Vienna NGO Committee on Drugs, of which Esbjørn was a chair for many years. Okay, the other thing is, one of the things that really I think is very important is that you as civil society organizations actually meet the people who are helping countries to implement these policies. And this is UNODC in this particular case. This gentleman that you see here is our executive director. This gentleman here is a new chair of the Vienna NGO Committee on Drugs who replaced Esbjørn, right? So we bring them together to discuss in a panel how civil society can and are contributing to the world drug problem. And I will talk about this particular booklet later on. Okay, so we have the 2019 Ministerial Declaration. It's a declaration. It's a declaration, right? Which means it's not a policy document. But it's a declaration that affirms the different policy documents that member states have adopted in previous years, as Esbjørn has mentioned, the 2009 Political Declaration and the 2014 Joint Ministerial Statement and the 2016 Angers Outcome Document. It was a confirmation of those policy documents. Now, the analysis that I'm going to do, I'm going to try to give you an analysis of what this document actually contains and how it relates to you. It's not an easy exercise. It's not a long document, but it's a political document. That means the language is a political language as well, right? And my starting point is actually the 7 chapters of the Angers Outcome Document. Are you familiar with the Angers Outcome Document? Okay. Diana, I think they already received information about that, right? So I made sure that I send the organizers the information so that you can actually read through those to prepare for this session. So in the Angers Outcome Document, we have 7 chapters. So, and those chapters were also affirmed in the 2019 Ministerial Declaration, and that is my starting point, to see how the Ministerial Declaration references or sees those 7 chapters and give you examples of what civil society organizations are doing to help you understand that political language a little bit better, okay? So let's do that, let's start. Okay, the first chapter is on demand reduction, okay? Now again, it's a very long text, but what I've done is simply to take the text or the reference that was relevant to demand reduction here. Member states in this particular case, they use a political document, as I said. They agreed to strengthen effective, comprehensive, scientific, evidence-based demand reduction initiatives covering prevention, early interventions, treatment, care, recovery, rehabilitation, and social reintegration measures on non-discriminatory basis, right? This, if you read this, it's a political document, but really these are the things you've been hearing for the last 2 days. Probably you're going to continue hearing tomorrow as well, in the work that you do and your colleagues are doing here. what we also did is to do a little bit of an analysis to see how is this actually linked to the Sustainable Development Goals, because we talk about Sustainable Development Goals a lot as a framework that actually helps us not only to plan interventions, but actually also to evaluate how we are doing. So we have seen through our analysis that this particular chapter is related to SDGs 1, 3, 4, 5, 8, 10, 12, and 17. I'm not going to go through them because I am sure you know what they are, right? You know what the SDGs are. Probably it would be nice also if you could do a little bit of analysis to see which of the SDGs is your work is actually contributing to. I think it's a nice exercise to actually do. So to illustrate what this actually means in an NGO context, I pulled out an example that you might be familiar with, of the work that is related to this. Without saying too much, the project was presented yesterday. Vendor, no. Say no, right, to drugs and every other bad things. This is, in terms of what this particular chapter means, this is actually one of the examples of what it means, right? To do projects related to demand reduction. And again, here I'm not going of and access to controlled substances. And here again, what is important is that member states agree to ensure access to and availability of controlled substance for medical and scientific purposes. I'm sure those of you who are familiar with the work of the UN, this is our position, right? So we do not advocate for the availability of substance for any other purposes other than medical and scientific use, right? Including for relief of pain, suffering, and address existing barriers in this regard, including affordability. Now, I do not know the context of India, but one of the problems that we have around the world is that certainly for scientific, and this is one of the main aspects that they have agreed on. And here, again, the three SDGs that are related to this is 1, 3, and 17. And to illustrate this is one example of what one of the NGOs is doing. And by the way, if you have a good example, you can send it to me. We continue to update our guide, and we can actually put that into our publications. This particular organization, the International Association for Hospices and Palliative Care, is working to ensure that universal access to high-quality palliative care is integrated into all levels of healthcare systems. In this particular, in the case of Colombia, right? So they're not doing it everywhere, but in the case of Colombia, this is a project that they are doing. So this is what it means for you as civil society organizations. How about supply reduction? Okay. Here, member states agreed on a number of things, really. I mean, you can see many points. Again, this is usually it's a long document, and I found these 4 points being most relevant to this, and to you as well, of course. And this is the issue of the prevention and countering illicit crop cultivation and the production, manufacturing of and trafficking in narcotic drugs or psychotropic substances, including synthetic drugs, new psychoactive substances. Also, the issue of reducing and eliminating the diversion of illicit trafficking in precursors and money laundering related to drug-related crimes. And then, of course, issues related to addressing socio-economic issues related to illicit crop cultivation and production. Here, I mean, when you talk about these particular issues and you think about why communities actually cultivate drugs or do drugs, there are a lot of socio-economic issues out there that some of you as civil society are actually addressing. But they're also committed to strengthen bilateral, regional, and international cooperation promoting information sharing. This is key, right? Because drug trafficking, for example, is one of the transnational organized crime, which is the other part of the work that UNODC does. So it's a cross-border issue, and sharing of information is quite key. What does this mean for you as civil society, or what are some of the examples? First of all, those are the SDGs that are related to this particular chapter. And in terms of what civil society are doing, we have an example of this particular NGO, I think it's from Argentina. They work to foster and protect human rights and to strengthen the democratic system and the state in the state of and the state of law in Argentina. And here they're implementing a project called the Internal War: How to Fight Against Drugs. How to fight drugs pretty much in Latin America, right? Okay. Moving on human rights. I heard, the sessions that we started with this morning, they were really focusing on this particular issue of human rights, particularly, of course, women and children. Well, we started children, I think those two categories pretty much, more children and young people. And here, member states, they again affirm their commitment to a balanced, integrated, and comprehensive multidisciplinary and scientific evidence-based approach to the war drug problem, based on the principle of common and shared responsibility, and recognize the importance of appropriate mainstreaming gender and age perspective, with a particular focus on women, children, and youth. And again, I'm very happy that the organizers actually made a good effort to include young people in this particular conference, especially in tomorrow's sessions, because like many other delegates actually said, and I think there's a delegate this morning who said we should regard young people as citizens of today. That's a powerful statement actually in itself. It almost goes without saying, but one of the issues that we see around is that young people are seen as citizens of tomorrow. And you know, tomorrow never comes, right? Tomorrow, there's always going to be a tomorrow, okay? Today is today, tomorrow is tomorrow, but when we are tomorrow, there will be another tomorrow. So what we have seen is that young people have just been ignored pretty much in many respects because of this particular approach. So I'm very glad that, that the organizers put a particular emphasis and gave space for young people here. This is what we see in the UN, this is what we believe in the UN system as well. We really should give more space to young people at the table, especially when the policies are being discussed. The youth-focused policies are being discussed, young people should be there and provide their input. And here, the SDGs that are related to this are there. And I put out an example of another NGO that you might be familiar with. I'm not sure whether Roger Kazira is in the house. Roger's, he's probably not here. Okay. Yeah, they present, I think he was at the panel yesterday. He did present what they're actually doing with young people over there to enhance socio-economic transformation of disadvantaged young people through advocacy, psychosocial and skills development for self-reliance. And here again, you know, creating resilience within communities. I think it's part of a prevention effort, right? Creating resilient communities, especially young people. Okay, how about the issues related to persistent challenges and threats? Okay, here we see that member states are certainly committed to facilitating informed scheduling decisions on the most persistent, prevalent, and harmful substances. And here, I mean, SBO knows, those of you who attend CND intersessionals, you know, I think in September, in fact, we're going to have a particular intersession that is also going to include scheduling. There are always new drugs that are coming, and how can you control those drugs? One of the work that UNODC does, together with WHO, particularly actually most of the work is done by WHO, is actually to do this regular scheduling, to see what kind of drugs do we have, what kind of new drugs do we have, and where can we schedule the existing drugs. Maybe, you know, the trends have changed, the effect of a particular drug has changed. Where can we schedule that drug so that countries can actually put in place policies to deal with it, within law enforcement, within communities. And here, SDGs are 3, 5, and 8. The example of what is being done in Italy, for example, by one of the civil society organizations is looking at reacting to emergency causes by the rise of substance abuse among young people. A lot of other NGOs, I think they have been doing, they have presenting the work that they're doing, have kind of rehabilitation centers where young people come and actually seek help of all kinds. So very similar to what this particular organization is doing in Italy. Okay, how about international cooperation? This is pretty much a little bit easier to understand. Member states here dedicated to strengthen bilateral, regional, and international cooperation. This is, of course, important because the drug issue, like many other issues that communities are facing, they're very national. Sometimes they're very local, even, but they're also regional in nature. So improving or increasing bilateral, regional, international cooperation is quite key to addressing the war drug problem. Of course, because again, the other issues that is related to drug trafficking is, for example, corruption, right? It's probably a subject you're familiar with. I don't know the context of India. But I don't work in this region, but I have a colleague in-house who is in our UNODC office in Delhi. But yeah, corruption is one issue that actually needs to be addressed if you want to address the issue of drug properly. I mean, we did a study, UNODC did a study on, we were trying to understand how can we achieve SDG 3 in Nigeria, for example, right? Nigeria is one of the biggest African countries, and what we realized was that during our studies, we realized that the most corrupt area in Nigeria was the law enforcement. Law enforcement is the most corrupt institution in Nigeria. So if you want to achieve SDG 3, which is well-being and health, and you have a law enforcement that is completely corrupt, and you have a lot of drug trafficking in Nigeria, as you know, how do you achieve that? You cannot achieve SDG 3 in Nigeria if you do not address corruption, right? The same we did in Eastern Europe. I mean, somebody from Serbia, I think, a lady, our colleague who presented yesterday from Serbia. Sorry? Yeah, in any case, so in Serbia, for example, the most corrupt area, she can testify to this, in Eastern Europe is health sector, hospitals. You cannot get a hospital bed if you don't pay corruption. How can you achieve good health if you have, corrupt hospitals? It's almost impossible. So, and here the example of, in terms of international cooperation, what UNODC what civil society is doing is, for example, the work of the Vienna NGO Committee on Drugs, right? A lot of you, hopefully, are a member of the Vienna NGO Committee on Drugs, right? Yes, exactly. So that's great. I mean, that's one of the work that civil society can do. Facilitate this international, regional cooperation among civil society organizations. Member states, this is how they do it. You have to do it for yourselves. I mean, they're not going to do it for you. So obviously, this is one example of what a civil society organization can do. This is the last chapter. And it's probably one of the complicated chapters, alternative development. Because again, it goes to the heart of why do people actually cultivate drugs, right? And here, member states reiterate the resolve to strengthen the implementation of long-term and comprehensive development-oriented drug control policies and programs in order to address drug-related socio-economic issues related to illicit crop cultivation. We have, one of our projects that we have, for instance, in Colombia is an alternative development project to provide alternative means of cultivation to the local communities. Because I personally think that people, they don't necessarily have fun cultivating drugs. I don't think they like it. I don't think it's the most productive plant that you can actually have. But if they don't have an alternative to that, what are they supposed to do? You know, one of the things that I actually talk about, because I think what you are actually doing is actually planning interventions for a particular security problem. Believe it, it's a security problem that you are dealing with. It's a social security, right, that you are dealing with. So, and if you know a little bit about the concept of security, it all comes down to what? It all comes down to survival, okay? It all comes down to survival. So if you have to cultivate drugs to survive, I think you're going to cultivate drugs. If you have to do drug trafficking to survive, I think you're going to do it. Sometimes we look at these people and they almost sometimes look, you know, seem alien to us. But I'm not sure. I'm not sure. If when it comes to the issue of surviving, I think any one of us will do exactly the same thing. Trust me. I'm not sure what you do when you have to ensure your survival. I hope you're not doing that. But to be quite honest, when you're desperate and you want to survive, you will do it, okay? You will do it. So in any case, that's the issue. You have to provide alternatives. And actually one of the good things that I like about this conference, what I've been hearing, is that you are providing a lot of alternatives. You have to provide incentives too, right? People are not just going to be convinced. People talked about young people being told that using drugs makes you feel good. If that's the message, they're going to take it as that, unless you give them an alternative, right? And an incentive, if they have already started, in order to come back, they need a good incentive. So we need to provide that, and that applies also with regards to alternative development. And those are the SDGs that are related to it. And here I put out an example from Thailand. I'm sure SBO knows this particular organization. They're doing a lot of work to help people living in poverty and in marginalized communities to provide them with different types of alternatives to cultivating drugs in this particular case. And they say that thanks to their work, the beneficiaries no longer need to rely on drug, crop cultivation, or other illicit activities to survive. Right, right? I mean, I didn't even know that that word was there. Survive. I didn't even know it was there. But they were doing it because they needed to survive. So obviously, that's quite key, I think. Okay, so that was the analysis of a very complicated policy document that we actually tried to put it in a more, let's say, comprehensive, easy to understand language for you to actually be able to navigate through. If you are interested, of course, then you should have, perhaps, and if you have not read through the entire document so that you have a complete, comprehensive picture, but this is actually what it is when it comes down to, right? And one of the other things, as I mentioned earlier, that we are doing to help or to build your capacity is to publish guides, right? Different guides on how to use the 2019 Ministerial Declaration and what it means to you as civil society organizations, and what are some of the work that is being done by your fellow civil society organizations. And we launched this particular one actually in Vienna in March during the ministerial segment itself. And the examples that I showed you, they are featured in this particular guide. So Diana, she has a copy of that. It's actually very nice and it's flexible that we have an online version that we can update often as much as we want, and we can feature as many examples of your work that we want. There's no limit to that. So if you have an example and you would like to send it to us, we'll be happy to include it in our next version. Okay. Then I think I'm done with my analysis. So the idea now is that based on this and what you have already received, that we work together in an interactive fashion to try to see, okay, what does this actually mean to you and your work? And how can you do your work better, right? So based on this particular one, because again, I think there's a need to come up with concrete recommendations, and I think we need to facilitate that process as much as possible. And this is going to be pretty much for the rest of this afternoon, right? Before I go there, Dan and I will, and our colleague here, we were discussing how do we do this, and I think, what did we agree on? By country? Country and region. So, because again, this issue is very particular, we would like to divide you in countries and regions, and you work in those groups, because the recommendations that you're going to come up with are probably going to be country or regional specific, right? So it makes sense to actually, that actually you work in those groups so that we can come up with as close to, real concrete recommendations as possible. Yeah, is that agreeable? Right? Is that agreeable? I think we can do that. Here are the tasks. I think you're going to take your time. We probably have more than an hour for this, right? Based on what you have already received, the summary of how the different chapters are related to the ministerial declaration, which aspects of this declaration, meaning the demand reduction, access to medicine, and so on, which ones of those do you feel are more relevant to the work that you are doing? Okay, that's probably easy to do because it's your work. You just have to connect it to this, right? And then this point number 2, actually, I added it to my slides. I didn't have it. I added it after listening to you and everybody these past 2 days. I think, in my perspective, in my view, I heard a lot of wonderful work that you are actually doing. And I'm sure you already know number 2, but I think it's important to remind ourselves, why are we actually here? Okay? We didn't have to exist, or you didn't have to exist as NGOs. You exist because there's a problem, right? So why do we have that problem? I think, if possible, it's good to go to that level and see why are we actually even here. We shouldn't be here. So what are the underlying causes of the problems we are addressing, you are addressing in your NGOs? And then discuss how you can put, how you can put the different aspects that you have identified into practice. This is probably also easier because, again, it's what you're doing already. And then what are the main challenges? Right, in some countries, it's probably the lack of political will, right? In other countries, it's probably just in societal issues. Maybe it's corruption, maybe it's something else. What are some of the challenges that you are actually facing in doing your work? And then we would like that you discuss some of the recommendations based on those previous analysis that you would have done. Discuss some of the recommendations. So what new interventions or what existing interventions can we put in place? I mean, can we improve? What new interventions can we put in place? Or which existing ones can we improve in order to do our work better? I think this particular part will also fit into what the overall conference recommendations actually, right? So maybe that's a good starting point to put it to you to help the organizers to put together that particular summary. And then perhaps this probably is, for me personally, at UNODC, for us at UNODC, it would be good to know what kind of support would you actually need to do your work better, right? The governor said yesterday he's ready to support. What do you want him to do? What do you want him to do? Give you money? Open up his doors so that you can go and talk to him? What is it that you want? I think it's quite important to be actually specific and to think about and say, what do I actually want, right? From the UN, from other NGOs, right? Is it more networking? Is it more cooperation? What is it that you actually would want in order to do your job better? And then it would be great if you could present the outcome of that. Instead of me being here or anybody else, then you would take the floor and tell us, okay, this is actually what we have come up with as a group or a region or a country, and this is how, these are the recommendations that we can suggest, you know, for all of us to do our work better. So this is the agenda for the rest of the time. I hope it's agreeable. Is it agreeable? Yes, thank you very much. And on that note, can we put them in groups, Diana? Yeah? You can help me do this. We have in some cases, more or less people, but we're going to try. If you are from Sweden, you're probably not going to be in one group. Or from Serbia, I'm not sure. Yeah? Diana, let's see. So what is it? You want to come here?
So we have 24 countries, excluding Chile. I'll call out all the countries. I don't know how we want to regroup this. We have 13 tables. We have regions, and we have certain delegations which are large from certain countries. Like Sri Lanka, we have a good representation, and the others we will regroup. I think it will be interesting for countries from Europe, like Sweden and all of them, to sort of share tables to help us understand this better, because you all are working with the UN and the VNGOC. And I'm just going to call out these countries. If you all mutually feel there is some alignment, some understanding, some connections between the problems and the work we do, I think that will also be a reason to sit in the same group. Okay, so Austria, Bangladesh, Bosnia, Cambodia, Chile, Hong Kong, India, Indonesia, Jordan, Kenya, Lebanon, Macau, Malaysia, Maldives, Nepal, Singapore, Sri Lanka, Sweden, Thailand, Turkey, Uganda, Vietnam, Qatar. We did try to make these groups, but we know that we have 13 tables, and the first 5 tables we are clear that we can sort of regroup as countries. The rest we'll have to regroup as regions or NGOs working or civil societies working on the same agenda. Is that okay? Do we make sense? Yes. Okay, so table 1 could be India, 2, Sri Lanka, 3, the Arab nations. Is that okay? We'll club together. We can bring more chairs at the table. And the 4 and 5 could be regions from Singapore and Thailand, Maldives, Malaysia. I don't know. You'll have to decide how to come together based on our issues. And the rest of the tables could be countries who work on similar issues, or representation of civil societies who are here working on similar issues. Must be working with children or women or prevention activities in a particular area, rehab. We'll have to sort of move around and find those groups. Is that okay? Can you repeat? So India comes. India, table 1. 2, Sri Lanka. 3, the Arab nations. 4, Singapore and the countries around.
I'm calling out to Team Wenda to help if the delegates need chairs, extra chairs.
5, Uganda and neighboring countries. No, yeah, only Uganda actually. No, nothing else. But that's good. Yeah.
Say the other work-wise regroup.
Yes, yes.
Won't be able to do on their own. We have to select 2, 3 topics and then.
But
it's like. But for example, So the review team is going to be within the country, you're saying?
No, yes, that also can happen in work, in the work area. Because some are really large. But then there are just one or two from certain countries, but then they can relate to only their area.
The topic will be possible. Questions, do they make sense in terms of?
Yes,
Yeah?
yes, deliberately. They can come.
Yeah, okay. Huh?
You've done your homework and it's very clear.
Okay.
Looks interesting. The Arab countries, we see Jordan, Kyrgyzstan, Lebanon, Turkey, Qatar. Table 3.
demand reduction, see what are the issues that you, within demand, but that's already a big first step. You already know it's demand reduction. Okay, so within demand reduction, what are some of the issues then next to, yeah, based on the underlying causes of, but in demand reduction is very massive as well, right? So maybe you narrow it down to a few problematics that you are working on, and then you analyze the root causes of those problematics. Because if you look at, or you look at demand reduction, demand reduction in general in Sri Lanka, perhaps it's possible. For me, it would be difficult if I take it as a general problem without narrowing it down to bringing it to perhaps, I don't know, among young people or among women, I don't know, like, yeah? And take notes because you will have to present that. So
there is no project vendor representation in India.
You want to sit? Will you sit? No?
I cannot contribute. One of you guys or somebody.
She's busy with this. Sissy is busy with the delegates.
Shalini? One, at least somebody should be there. Or will Father Kuriakos be the vendor representative? He can't do that.
Will you sit here? What he's asking.
പോഡിയം. മൈക്ക് ആദ്യത്തെ ഒരെണ്ണം അവിടെ വെച്ചിട്ടുണ്ട്. ആദ്യത്തെ മൈക്ക് ഡാനിസ് കയ്യിലല്ലേ?
o'clock, right? Yeah. Just a second, just a little logistical announcement. Because, as I mentioned to you, you will have to present your recommendations, right? So in order to make time for that, we would like you to finish before 5, okay? Before 5, you should finish and have already your recommendations ready, and we present the recommendations around 5 o'clock for about 30 minutes. And then we will have to keep you here a little bit longer than planned, but dinner serves at 7 o'clock anyway, so we have time. So just so you know, please finish just before 5 so that we can start with the recommendations presentations at 5 o'clock for 30 minutes, and then we go into the Q&A for another about half an hour. Is that okay? Okay? Okay, great. Thank you.
I request the groups to work towards closing your discussion. We're going to change the timings a little bit because we have a couple of groups who are ready to present. So let's respect that. And so but the rest of the regions are ready. So I think they should buck up. Only 3 questions.
Okay, there are the recommendations now.
Okay.
Okay.
Yeah, okay.
If they can do recommendations, even if they don't do the last one, if they can do recommendations only, that's okay.
Yeah.
Just give them another 5 minutes.
Then you can tell them that.
I can only say. I think we're good.
Yeah?
Yeah.
More difficult, but it's engaging and they're more open and I think we can wind up, close, and decide on the person who will represent your region. Yes. Yeah. Even, yes, they are ready.
India, are we good? India is good as well.
Yeah.
Okay.
Yeah, we can just come, right?
Okay, so thank you so much for your hard work and very interactive exercise that you've been doing. I think we can have this exercise for the rest of the day, for the rest of the evening, even for several days. So, but we have to come to a close. Otherwise, you're not going to have dinner, you're not going to go to sleep. So it's actually in your own interest to finish now. Okay? So let's finish now. And we are going to, or you are going to present the recommendations that you have come up with. And the idea is that you have identified one person who is going to come here and present those recommendations to us in less or no more than 5 minutes, okay? Because then we have 5 groups. Less or no more than 5 minutes. So, volunteers, who is going to go first? Okay, we have a group. We have a volunteer. Okay, so you present what your group is and what issue you have identified and what are the recommendations that you have come up with. Thank you so much.
Thank you. Okay, so I thought we would go first because we're only 2 people from Sweden, or we're actually 4 people from Sweden, but we lost 2 of them. We didn't either really do what we were supposed to do, so that's why I also thought that we'd go first, so then, you know, there's more time for everyone else. Sorry, we didn't do the first bit, but we just went straight into recommendations. So we were talking about how to create a situation where youth don't get into doing drugs. And we came up with an idea, or we didn't come up with the idea, but we were speaking about the Icelandic model. Has anybody heard about the Icelandic model? Yes. So it's a strength-based approach. It's evidence-based. It's worked really well in Iceland. I think they've halved all their statistics within 7 years of the program. And now they're at an all-time low with drug use, alcohol, and tobacco use among youth. So what they do is that they focus on the school, make sure that every child is seen in the school, make sure that you have time with your teacher, make sure that you have a valuable day at school. You do activities like this, interactive activities, and not just sit and listen to somebody all day. Another Swede. We work with the family, or they work with the family, so it's not about quality time, it's about quantity time. So the more time with parents. So Diana said that a lot of parents here in Kerala are away working abroad, which might be one of the reasons for more use, because it's very important to just spend time with your family and your kids. And that you have parent support groups, parent-to-parent groups. It's good that you know the parents of your children's friends, so you can work together. You can you know where your kids are and what they're doing. And then the last one is quite different, but it's a curfew. So in Iceland, they implemented a curfew that after a certain time, earlier in the winter, later in the summer, because of, I guess, the sun, that you have your kids go home. So you get like little sort of magnets for your computers, or for your, what's it called? You get magnets for your homes. Fridges, yes, where it says, is your child home? Where is she? Where is he? So did I miss something? No. So that's what we did. And then Sweden is quite different from here, as we've heard. We have a big social service sort of situation going on. So all of our services that are implemented go through social services. So we had like a next step after the Icelandic model to register all the children and everyone in the country, and to also do some sort of implementation of government social services. So that would be our recommendations, big recommendations. Starting a little bit smaller with Iceland and then bigger. Thank you.
Thank you so much for, thanks to the Swedish team. Obviously came up with a very interesting and different recommendations, I think, to what other recommendations that we're going to hear, which is great, I think this is what we actually want to see, because it would be boring if you have the same recommendations for the issues we're facing, because the issues are very varied and very diverse, and therefore the recommendations will also be very diverse. Just to stress that we will ask you to actually write down these recommendations nicely, right? So as you have them in a paper, you can even draft them better, because they are going to be fed into the conference recommendations as well. So just make sure that you understand that particular point as well. Okay, great. Thank you so much again. So who is the next group volunteering to go? Otherwise, of course, we can always impose, but I see a hand over here of another volunteer. And again, you introduce your group and the problematic that you are presenting and the recommendations that you're proposing. Thank you.
Basically, I have no group. A Lebanon Arab group hire me to present. I am from Bangladesh, and Arab group, only Lebanon is there. So we work together, and we discuss many issues. Lebanon country situation and Arab situation and our situation is different, but we are trying to make it same and come in the similar issue we bring together. And we are considering, based on this presentation and ministerial declaration, we identified and answer our demand reduction and human rights issue we identified against question 1. And especially for the women and children, they are the underlying issue, and they have no enough support from the community, government, and as well as international organization. And activities we are providing to address this issue, very limited detoxification for the children and women, rehabilitation and follow-up services with medical, legal, and other services. We are advocating for the implement evidence-based prevention services and also treatment services, and education services for the juvenile system, especially art therapy, literacy, this recommendation from Lebanon. And we are facing many challenges, though some are similar with Lebanon and Bangladesh, lack of political commitment, limited resources, and lack of proper policies to protect human rights for the women and children, and lack of comprehensive services. There are many organizations, governments are working, but scatteredly, they are not together addressing this issue. So this is another lack. And based on these challenges, we have some recommendations. Need strength and capacity building service to implement evidence-based prevention program and treatment services also. In Lebanon, there is no enough UNODC presence on drug prevention. They are implementing crime prevention in Lebanon, but they are requested UNODC to come forward and take drug issue also in Lebanon. In same situation in Bangladesh, there is no presence, enough presence in on drug issue. Allocate resources for state and civil society organization. This is another recommendation. We have no enough resource, and civil society sometimes implementing some small project. After the small completion of the project, there is no activities. So continuation is intervention is very important. And finally, we are recommending for information sharing and regional, multilateral, and national multilateral coordination and cooperation is very important. Government, UN agency, and civil society need to work together for bridging this gap for the children and women. Thank you. This was our recommendations.
Thank you so much for being also very, very specific. You know, I mean, again, for those of you who implement projects, you know that the lower you can actually narrow your target group and your intervention, the more successful you can be. And it's great to see that they managed to bring it from the demand reduction as a whole to more specific issues focusing on women and youth. And I think one of the things that has stuck out for me is this issue of sustainability, ensuring sustainability in the project that you do. This is a very important recommendation because we see a lot of this in NGO work where you do work for 6 months, and then what happens after 6 months, or 5 years, what happens after that, right? So the intervention, when it does no longer exist, it becomes problematic. Okay, so thank you so much for the recommendations from the Arab group, and thanks for supporting the minority group over there. Thanks for that. Next group, I had seen a hand over there, but is it still up? The offer is still there? Okay, great. Thank you. If you find space to go through somehow, okay, over there. And again, the same exercise, and looking forward to hearing your recommendations.
All right, thank you very much. How's everyone doing? Good? Good, huh? All right. Right, so very quickly, I think our group, we spoke a lot about the work that we do, and it falls mainly under the category of demand reduction. A lot of the work that we do centers around prevention and also helping people stay away from drugs. A lot of the work that we do also centers around advocacy, where we advocate for drugs to be classified as an illness rather than as the consequence of a crime that's committed, which is the consumption of drugs. Because we find that if we classify it as an illness, proper care and treatment can be given, rather than we throw them into prisons behind bars where they might just be forgotten and may be neglected in terms of their needs. So this could also be seen as a human rights issue, where illness is not treated, but rather you just shove them aside and put them away until many years later. Then that doesn't really solve the problem. So on the next part, some of these underlying causes, we've identified them to be the changing attitudes towards drug abuse. Drugs are no longer seen as a taboo topic among young people, especially young people today. And also, a lot of young professionals also have a more lax attitude towards drugs, being more educated, being more savvy. They are able to evade the typical ways where people detect drug abuse. So this is indeed a concern. And young people these days have access to the internet. They can order drugs from even online. NPS is on the rise because of because it's deemed as a legal drug, because ultimately NPS is a concoction of legal ingredients anyway. So all these have actually changed the landscape of drug abuse from what we know perhaps 10, 20 years ago. So all of these emerging challenges are things that we need to be able to tackle going forward. Other things that we talked about also include societal pressures. The system or social structure itself contributes towards drug consumption. So for example, in the education system, because your education system demands a lot from young people, because your work demands a lot from you, people might consume drugs just to perform, just to adequately perform to meet those requirements. Students might take drugs so that they can stay up all night to study, right? So all these things come into play when we look at the landscape in its entirety. So what do we hope to do and what kind of support do we hope to receive? We hope that various NGOs can come together to put up a resource portal of sorts with bespoke materials catered specific to the different countries, so that all this information, all these best practices and preventive drug education content is more accessible to people in various parts of the country, not just people who are centered in the capital city, for example, but even those in the far-flung regions, especially for those bigger countries. Other recommendations include for international organizations such as the UNODC to be more visible in large countries, for example, Indonesia. If you're only centered around the capital city and you don't make an effort to have a direct contact with NGOs, they wouldn't really understand what you are trying to do, and what you are trying to do might not be reached to all those different parts of the country. So that's what we hope to see, and also more training for NGO practitioners. So for example, if let's say they are dealing with clients and they do not have capacity to deal with those clients with specific needs, for international organizations with their know-how, with their evidence-based practices, to really come down to the ground and not just be centered on one part of the country, to really get down there to impart your knowledge and your expertise to them so that they are able to render the services from wherever they are. So with that, thank you very much.
Thank you very much as well to you, or especially to you for this also very specific recommendations. I think one of the things that you mentioned that is actually important and that we actually know that we're not doing right is to actually get our work where it should be, right? We're not doing a very good job as UNODC or UN in general to actually be where people need it most. Although we're doing a lot of good work, people simply do not know about that particular work. And I think creating an NGO platform, as your group suggested, is a great thing. And I think this is already a good, actually, environment to start that particular platform. Espion knows where's Espion. I mean, there's a so-called NGO marketplace. It does exactly more or less the same thing. But yeah, you can come up with better ideas, for sure. Okay, so thank you so much. Next group, please. Next group, volunteers. Okay, we have a group here from Sri Lanka.
I'm Nana Dhanapala. In our group, I think we identify the demand reduction is the, mainly the demand reduction, and the underlying cause is that in our country, in Sri Lanka, it's a big problem because they are the industries mainly they are creating continuous demand. So because they are using media, then they are creating a culture, and in this culture, I mean even the cultures and subcultures also, and users, non-users, sometimes activates also in this culture, like user-friendly culture. So, so our main underlying cause is the continuous demand created by the industry mainly. So methodology, how we select this one, by finding the factors which are creating this demand, and by research, action research, experiences, and learning from mistakes. Likewise, we that's the methodology. And the action, we thought, even now we are mainly doing mainly the children, youth groups, and community to identify the real chemical effects and the other effects of drugs, like learning effects, that which create attractiveness like this. So we are like trying to like differentiate what are the chemical effects, real chemical effect. It's not pleasant, and likewise, and why they are using because of this attractiveness. That's what we are trying to promote, and we are continuously doing it. And identify the vector, that is mainly the industry, legal and illegal industries. And we are like, we let mainly the community groups, children, youth, for them to identify the vector and counteract the vector. So we are doing that through youth groups and community groups. Strong rehabilitation programs that address the contributory factors that create demand, and also that make the individuals completely independent from the drugs and let them lead to a positive lifestyle. Those are the activities. And challenges, lack of funds and other resources, lack of implementation on existing, because there are a lot of violations and things like that. Policies are there, but it's difficult to implement. And the interference of the traders to block and weaken the interventions we are doing. And the social benefits, social beliefs, myths, and stigma related to drugs, drug use, and about drug users. Opportunities, we have a strong civil society support, and we have a evidence-based methodology and well-trained workforce working together. Recommendations, creating governments, to create government support for demand reduction activities, establish minimum standards for prevention and treatment interventions, provide necessary resources for demand reduction interventions, and to develop a platform for monitoring and evaluation. Thank you.
Thank you very much for that detailed report of your group. Obviously, I think a lot of the challenges that you have identified are common in most of the groups. And yeah, I mean, one of the things that I picked up was this lack of the implementation of the existing policies, right? It's not like we're running out of solutions that are actually there. A lot of the solutions are just not being implemented or not being implemented properly in a different context. So, and again, the support of government obviously is one of the recommendations. You would like to see this more in Sri Lanka, and I think this also applies for other countries. Okay, we have 2 more groups to go. Who would like to go next? Okay, the gentleman. He was louder. I guess he was louder than you, but your group is bigger, so it's good that he goes last, I suppose. Okay, great. Looking forward to hearing your recommendations.
One of the lost Swedes. Yes. I was challenged to do it in 30 seconds, but I hope you will give me 1 minute at least. Yeah. I want to start with the courses. For us, and I shouldn't have taken off the glasses, I can't see what I've written. So, for us, we found 3 courses: corruption, inequality, poverty, and that people are misinformed or misunderstand drugs. And that we have a little bit wide courses is because we are a conglomerate of people from Vietnam, Cambodia, Thailand, a fake Thai, and the Maldives. Sri Lanka forgot their friend, their island friend. Yeah, we had to join him, and we are very happy for that. The aspects that we see linked with this that we think is important to work with is demand reduction, human rights, and international cooperation. And for us, how we address this is through community networking, mobilization of people in communities, and empowerment of people. And that we choose this is because we see in our countries that the space for civil society is shrinking and is lacking of people's participation. It's being done for them. And with all these policies, documents, and so that we are talking about, the ministerial document also, we still feel it's people's participation that is missing. We must empower the people to take charge of their own lives. We don't need to do for them. Many of them are capable of doing it themselves. But we need to give them the chance to do that, to give them the tools and the resources. That can make a big difference, at least as we see it in our countries that we are working in. So that's our recommendation. Give people the tools and the power. They can make a change in their lives. Thank you.
Very short and to the point. Give people the power, right, to do the work. In many different ways, that's exactly what you are doing, and that's what we are doing. I think then the challenge is how can we do that together, right? And that voice has been coming out of this conference more and more. How can we do this together? So thank you so much for being brief and concise. Last group, but not least group for sure, is a host group, right? So it's probably appropriate that you're presenting the last, please.
Hello. Yeah, so the have to and want to has made a change now. So let me just start with the problems that our country would like to address. That is the accessibility and the easy money that is being made. Then the medias, in particular, the power of perception that the media is putting into. Then the peer pressure that I addressed earlier. Then the vulnerability that is based on the biological factors as well. Then poverty, stress, then the power of alcohol and drug industries and mafias that is existing in a real big pace, and the problem of unemployment. Then what we felt was civil organizations are not working together as one single body. And then the knowledge of the side effects. There are a lot of areas which, especially on the terms of medical aspects, that people should be aware of, especially students and everyone else too. And last but not least, there are no alternative strategies that have been properly addressed. So coming on to the recommendations that we would like to make, we recommend that there be more communities that come together so that these problems can be addressed well. And we need close civil societies, such as the People's Organization, to come along with the government so that we can make a better impact, especially in a country like India. Then bringing more stakeholders under one umbrella as they can work together, sharing a lot of ideas, and coming together on a regular basis would be a way through which they can work properly too. Then making a common framework addressing the issue of alcohols and drugs so that, they have a common framework and they can alter according to their local changes and the necessities needed. Then, then especially in schools, we need the curriculums to be made more strong so that in the earlier stages itself, people and students are well aware of what to do and how to do on these, about these alcohol and drug issues. And then social media enhancement, since social media and the mass media is playing a big role in the societies and the way everyone perceives something, we think that social media enhancement is really much necessary. And then introduction of more activities and alternative activities in schools and colleges so that people can switch from A to B. They can just switch themselves to a better world without alcohol or drugs. And finally, the support that we would like to gain. We would like the support on so that the surrogate ads can be banned, because the surrogate ads do play a big role in changing the minds of the people. And then in terms of funding, we need a lot of funding, quite a lot of funding to, compete with the big mafias and big industries that are against us. And finally, more treatment centers be made so that the women and the children can be, treated well and taken care of. So that's it. Thank you.
Thank you very much. And it's also very encouraging to, I think there was another group that involved a younger person in, at least in their presentations, and it's very encouraging to see also in this particular case that you did delegate this gentleman to be actually your spokesperson, because the future is here and they need a say or a space at the table, and you did give it to them. That's exactly, I'm sure that's what you're doing across the board. So we're done on that. Really a long list of recommendations. Again, you bring back the issue of being involved more in schools and colleges, because I think we will see this, we will hear this more tomorrow, as where schools certainly are one of the best entry points, especially when you want to address drugs or at least, I'm losing the word right now, but reach, exactly, that's the word that I was looking for. Reach young people, right? Because there are some of those vulnerable ones when it comes to drug problems. So reaching them through schools and colleges is actually a very important aspect. So a lot of recommendations coming out of this particular exercise. Thank you so much for your contribution and your active participation in this. As we mentioned, Diana will probably, or maybe our colleague, that will give you more clearer instructions, but we would like to see these recommendations actually reflected in the overall recommendations of the conference. So it would be good if you could prepare them nicely and then perhaps send it to the organizers at some point. I don't know, they will give you that particular instruction. At this point, at this point, my understanding is that we're going into the Q&A. You didn't get a chance to ask questions after my presentation. But now we have a good chance actually to do that. Espion will join me here at the podium, and then we will have a Q&A session with you before the dinner if you have any questions at all. Espion? Okay, so really any questions related to the 2019 ministerial segment and the role of civil society participation in the UN intergovernmental meetings, UN work, UNODC in particular, UNODC work, we will be happy. And the role of civil society in that, of course, how civil society can better engage with UNODC on issues of drugs and the work that you are doing. I think we will be happy to try and answer those questions. Thank you. Floor is yours. Yes, sir. We will take a few questions at first, and then we answer. Do you have another?
Hi. So a lot of my friends who want to do good work, they say, yes, we want to do this, we want to do that. So how do we make a big impact? So a big impact means you start a NGO, right? And if you want to work big, then you have to bring a lot of people, pay a lot of salaries. So how do you get money from? So at least in my friend circle, everyone seems to believe starting an NGO is a very difficult thing, should not be done. So can you guide how to get funds, or generally what is the easy way to start an NGO, or is it easy? I mean, yeah. So if I have a passion for a particular cause and want to do it on a big scale, and I need funds for that, how to go about with it? Can there be some guidance on that?
Okay. We'll take a few more questions.
I think my colleague has also been to 2-3 meetings, especially working on alcohol and drugs. But every time and in every meeting, our member state is not present. So what would be the role of the UN to bring in our member state? Because we, civil society, being together, fighting the issue, is in a different level. But when we shared, the lobby, the mafia, the politician, the power, everything is much, much stronger than what we are. Unless we bring the member state and pin them down with some responsibility, and then we could see some change. And continuously being absent in an UN forum when several other states are present, what would be the role of UN to see if they are continuously absent? What is the strategy to work on to bring them to the forum, especially on the UN body? In India, we have 4 or 5 states which doesn't produce alcohol, sell alcohol, though there is a supply. But then there are states which who are not practicing the production, sales, and that. But at least those states, members can be present to share the best practices or the learnings. And just looking at UN role on member states. Thank you.
We can take one more question before we answer. Anything, or even a comment. If you don't have a question, you have a particular comment or an observation, or an experience you would like to share with your colleague or with us. Okay, we take these 2 questions, and then some of you are probably still formulating your questions. Let's see how it goes after these 2 questions. Yeah, Esbjørn, perhaps you can take the first question on how do they get funds? If the gentleman wants to start an initiative on addressing drugs, he's a doctor, but perhaps he's already been inspired by so many civil society organizations that are here, and he probably wants to start his own NGO. Where does he get the money from?
Yeah, please tell me. No, well, I'm really serious concerning this, because I think that if we call the civil society organizations present here the prevention side of civil society, we are struggling, all of us, on every level to get funding. I have tried, when I started, I can tell you my life story very short in 30 seconds. I started as a volunteer in my organization when I was 14. Then I was fed up with the organization when I was something like 17, 18. And then I had the possibility to go to a camp with the international organization. So I had to continue for 3 years. And at that time, I was not fed up anymore. But then, a couple of years later, I thought that maybe I should be a civil servant and go into government or something like that. And I did that for 17 years. But after, there was something in my mind that kept me into the civil society, and I was asked to run a fundraising campaign in Sweden for my organization. So I quit my job in the Gothenburg city, the second city, and I started with the fundraising, and that was not easy. We had orchids from Thailand that we bought cheap in Thailand. Lufthansa and Scandinavian and Thai Air, they brought flowers to Sweden very cheap, and we sold it quite expensive. So we had some revenue from that. But after that, it has been really, really hard for us in Sweden to have money for prevention, I must say. And if we are talking about substance abuse, you know, when you're coming to some people and say, could you please give me, could you support our work, our international work on alcohol and narcotics in the Golden Triangle? That's very far from them. If we go for, can you support our work with a family home in a slum in Bangkok? It's easier. Or a child supporting a project in Myanmar. That's it's easier to have money for that. But when you're coming to prevention work or policy work, it's more or less impossible for us in that countries. We thought that maybe we could go to Thailand and have the Thai to have fundraising by themselves to support the projects in Thailand. We couldn't manage that. We have got money from the state when it comes to WFAD to run this kind of forums in Sweden. We have also got money from 2 big cities in Sweden to do it. But when it comes to organizing such an event, there is no one who would like to come, even in our Western world, to support that, as we have found. So we need to have membership fees. We need to find local contributors that can come up with some money. And if you are dealing with a project on the local level, then it's quite easy. I say it's not easy, but it's easier. When you come to the national level, it's much more difficult. And I try to see when I was discussing with Indians, some years ago, I said that, oh, you have so many rich people in India. You have so many companies. If you got 1 cent for each shoe from Bata, that will cover all prevention in India. So please go to Bata and say that, can we have 1 cent for your shoes? Oh, well, Bata has their own projects and the money, you know, it's very difficult. It's the same with Tata. It's the same with more or less every big company to go. But if you find some people who are committed inside the bank, inside, we have seen it on the stage yesterday, for example. I'm so proud of what Twenda has done when it comes to discussing with people. You need to go personally to them. It's very hard, but you need to find the right person inside the company to fund the local or the national projects. When it comes to global level, we are starting a project, and Ergin has escaped from the room, more or less, yeah. But we have started together with Green Crescent and Forut and a number of other organizations, what we call the Istanbul Initiative, where we try to have a group of prevention organizations seeking funding from the international level to do training with people in the regions. Because as I heard as well during those days, training, capacity building, what we have done here, but also going down one level to help you in different states in India or in small countries in Africa, Nigeria, for example, the smallest one. We need to have funding from the international level. On the other side, our, well, not enemies, but the other people from civil society who is working with legalization and so on, it's much easier because they can have funding from those who will earn money when people are abusing, when people are doing, when they start smoking marijuana, when they are drinking alcohol, when they are smoking tobacco, or whatever they are doing. The companies are earning of that, and they could see a revenue coming. So it's easy for them to marketing through the civil society, and civil society through social media and so on. I'm so sorry, my friend from India, that I cannot say that, oh, hallelujah, we do like this. No, it's hard work, but I know that you can do it if you really try. And there is a competition inside the room, because if all of you are going to the same people, you need to, in a way, to coordinate, and you need to find common projects and then present it in a good way. Then I think you will manage. Was that some kind of an answer?
Thank you so much. I think that was a very good and honest answer, actually. It's a very honest answer. Yeah, and there's not much more that I can add to that, because when he says we don't have funding, I know that he also means that we're not probably doing that much from UNODC side in that particular regard to support civil society organizations in terms of funding. It's not easy, but it's possible, and I guess the message that we can take out of this is that if we can do it together, we can actually reach more. You know, I mean, I think the good example is as a project vendor. I mean, I was telling a colleague that UNODC will probably not have been able to pull out this particular conference like this. I can imagine it's not a cheap conference, but you managed to do this. So it's difficult, but it's possible. Okay. On the point of our colleague, I think, yes, over there, in terms of how do you get member states to come to these gatherings where they, you as civil society organizations can, talk to them openly and share your concerns with them. I'm not sure whether I am mistaken, Esbjørn, maybe you can correct me on this particular one, but we have actually seen a positive trends towards the openness of member states where civil society organizations are present and the dialogue, kind of dialoguing with civil society organizations. You have to remember the drug issue is a very complex issue. It's one of the most difficult things that UNODC is working on. One of the most political issue that UNODC is working on. So it's not, and quite often a lot of countries are afraid as to what kind of voices that civil society are going to bring to the table. But I have to say that on a positive note, because of a lot of good work that some of your organizations are doing, such as Venda and other organizations that I cannot name. I mean, Green Crescent is one of them that we are familiar with. WAFAD, of course. Member states are coming more and more to the table and listening to civil society organizations. It's a process, don't forget. And don't forget also that we're talking about intergovernmental processes. Okay, these are intergovernmental processes. But I think the realization that in terms of the implementation, as one of the delegates mentioned, we need civil society organizations. So therefore, if we want to do comprehensive and effective implementations, we also need to hear from them. They realize, member states, at the table before we actually come up with those policies themselves. So I think there's still more to be done, and I think UNODC can certainly do more, and we are trying to do more within the limitations that we have. Don't forget that we are a member state-based organization, so we have what we call rules of procedures. We cannot go outside, we cannot operate outside those rules of procedures, because otherwise we're not going to exist as an organization. But we are trying to interpret those rules of procedures also to try to find ways to involve civil society organizations. But we need your help. We need your help because the work that you do will determine whether we can make a case for you to actually be to be at the table. You know, we have a lot of advocacy organizations, for example, that come to Vienna, and when the statements that they make usually is, you know, only the things that are going wrong in a country, without necessarily proposing a solution to the problems. You know, countries are not necessarily interested in that. They know. It's not that they don't know. Of course they know. But what are you proposing that that should be done? I think that's what they want to hear more, and a lot of you, that's exactly what you're doing, and you should keep doing that. And as long as you do it, I think this space will continue to open, right? Okay, do we have, okay, so we don't, okay, please add something.
Yes, I would like to add something when it comes to governments and so on. Because, as I said, when I was standing there, we have 3 different entities, or you can say, where the governments meet, in New York, in Vienna, and in Geneva. And they discuss the substance abuse question on all 3 sites. And in New York, they are run by the Ministry of Foreign Affairs. In Vienna, mostly by the Ministry of Interior or Minister of Justice. And in Geneva, by the Ministry of Health. And sometimes, if you have a government that is mixed with different parties, with different opinions, some countries have that, I know, they give 3 different answers on the issue. And this is very tricky, because we would like, from civil society, to have the same answer from Sri Lanka or from India on all 3 sides. And this is so tricky. And when it comes to where do they go, where are they represented, there is a criticism, for example, when it comes to Vienna, because a lot of Caribbean organizations, Latin American organizations, cannot be in Vienna all the time. So they would like to have it in New York and so on. But they have decided to have it in Vienna. Thank you.
Thank you, Espion. And I think that concludes this part of Q&A. Thank you so much for your active participation this afternoon. I know it's been a long day, so thank you for being there and participating and making this afternoon session successful and fruitful. Thank you very much.
Thank you. Thank you, Billy and Espion. And we have, Espion, we have, on behalf of Project Wenda, a small momentum. Espion, could you just hand it over to me?
Oh, okay.
I will have to,
Is it some funding I can... Please, really, thank you very much for coming here.
Thank you, Billy. Thank you, Espion. It has been such an engaging time. We've had a really hard day, and I can see from your faces that you're all so tired. So we will break for tea, and then we will come back again at 7 for an very interesting dinner. Team Wenda will have a very youthful 20 minutes presentation, and then they will teach you to dance. And we will have a little time of dancing. We need to we can't afford to be burned out, you know. We have one more day, so we need to recoup. So we have a little entertainment in the evening, so that is why we wanted to close early, so that you will all come back. We want all of you here for this dinner. I hope to see you all at 7. We have an agreement on that. Will we be here by 7? Oh, okay. And it's informal. I'm told that it's informal, so you don't have to really dress up. You can even wear the Venda t-shirts in your kit. Like I told you before, if we have it our way, all 3 days we would have been in t-shirts. So come casual. Yeah. At 7,